Hi everyone, myself Dr. Kiran Casey. I'm a dermatologist working in Haldwani. The topic which I'm discussing today is, do we need to treat pimples or acne? Okay. Why this question, why I'm dealing with this topic today is, yesterday I had a patient, a 16-year-old boy. He had come with his parents. Okay. Then I saw his problem was pimples in the face. Okay. Then I saw his face and told pimples. When I was about to say it's like how to treat and all, what causes it and all the factors, suddenly his father started a rant. Okay. Saying that these are pimples. I told him it is going to go off by itself. Why he does not require any treatment. Even I had pimples when I was young. Okay. I didn't get any treatment. It gone off by itself. Okay. Then I counseled the father. Okay, what did I counsel? Okay, first thing. Okay, what happens when a pimples comes on your face? Okay, it's not a life-threatening one. It's normal pimples. When it heals with the pigmentation. Okay, मतलब dark spots, yeah, scars. Okay, so what will happen? For example, you develop 5 pimples, yeah, 10 pimples. Okay, for example, 10 pimples in a month. Okay, and for a year, how many pimples you're going to develop? Okay, it's almost 120, 10 pimples a month. Otherwise, 5 pimples a month, 60 pimples. Okay, then each pimple is going to be healed with the scars. Yeah, pigmentation. So usually at what age the pimples comes in? In the teenage. Okay, maybe 12, 13, 14. Okay, till 26, 27. In few patients 30. So in a year, there are 60 to 120 pimples. This is the bare minimum I'm giving. So it means you are having 60 to 120 dark spots, yeah, scars. Scars are the depressions, okay, the acne scars, which is this slight, you develop a depression in the skin, okay, depression in the skin, okay, those are scars, okay, acne scars. So it's like, think for almost, for example, at least 12, 13, you're the whole age where you develop a pimple, some years more, some years less. So count the amount of scars and amount of pigmentation. Okay, so okay, some pigmentation with the time it can go off, but most of the pigmentation, sometimes scars which are deeper scars, tends to stay back. Okay, then I showed his face. I started analyzing the parents face, the father's face. I showed him he had scars on his face. I told him, see, you too have a scars. Okay, during his period, during when he might be a teenager, when he was young, it's like 20 years back then, that time your looks didn't matter much. Okay, it was hard work which mattered from the job perspective. At the end of the day, anyone is doing anything, you have to earn. Okay, from the job perspective. Okay, hard work matter. Whatever these Narayan Murthy's and L&T CEOs are saying, 98, 670 hours work and hard work, that mattered. But okay, now when some person is going out, it's the whole setup is looked after. How he looks, how he is presenting himself. Okay, when there are many candidates to choose from, okay, for any in any interview. Okay, even the IT interviews, particularly in the hospitality sector, it's very much important. Hospitality sector, matlab, if you are want to become air hostesses or any resorts or any other front desk, being a receptionist or any other kind of work. Okay, if any work where you are selling something or anything, if you have a retail shops or anything, you need to look good. Okay, because if you're offering if the same, if your work rate is the same, how you're going to differentiate? Okay, that time your looks and how you present yourself comes into play. It's like someone is taking an interview, he's seeing for you for the first time, even though you have all the records and all, how you have worked and all, sometimes it comes out how you look, that it becomes very important. So here having so many scars, yeah, pigmentation is not acceptable standards at this time. It might have been accepted that time, maybe 10, 20 years back then. Because back then the focus was how you used to work. Now these all things matter. Okay? If you want your kids, your children to work smarter, okay, they should also look smart. Okay? So don't give the children's knowledge, okay, about that. When I was young, I used to have pimples. It's okay, it goes off by itself. No, the need of the hour is treat your pimples. Okay, so always I say to my patients, when you treat your pimples, okay, if pimple stops coming, the new pigmentation also stops coming, new scars also stops coming. Okay, and we can easily treat the pigmentation later. That can be done. Okay, so parents, please be aware. Okay, treating pimples is also important. Okay, if you want your kids to be smarter and you don't want whatever these CEOs are saying, okay, 70 hours, 80 hours, 90 hours. Okay, work smarter. To work smarter, look smarter. Thank you. Wait for the next video.